not. Is this Miss Jaleesa Pittman?
Yes.
Hi, my name is Jasmine. I am the nurse practitioner today, and we're here for a well-visit checkup, right?
Mm-hmm.
Okay. So I'm just going to do like a full head-to-toe assessment. You might hear me just ask you to do a couple of things, and then I'll just give you some directions, and then you might also just hear me just like talking and stuff like that, and I'm just explaining things to my teacher, okay?
Okay.
So I walked into the room, I washed my hands and everything like that. Okay, so I'm looking at my patient. She is very well groomed. Her skin looks good. I'm not noticing any rashes right off the rip. Everything looks pretty good. Hair well groomed. Okay, so first, sweetheart, I'm gonna have you, let me see your hands. Looking at her nails. Her nails are well groomed. I'm not noticing any clubbing. I'm not noticing any rashes. Her palms, all the ridges look normal, no rashes. Flip your hands over for me, honey. I'm gonna just pinch your hands. I'm checking for turgor in her skin. It is good. I'm gonna have you give my hands a big old squeeze as hard as you can. Good job, good job. Okay, so right now I'm checking her strength. Her strength was good. I want you to pull my hands towards you. Good. I want you to push my hands away. Like push, push, push. Good job. Okay, while I have her hands here, I am just going to check her brachial pulses. +2, good job. I'm going to check her radial pulses. Okay, good job. While I have your hands sitting here and they're on your lap, I just want you to go back and forth really fast, just like this. Good job. I then want you to take your finger, so I'm going to have you take your thumb to your finger, each one, just like this. Good job. Try it with this hand. Right now we're just checking her coordination. She's doing awesome. Okay, I'm going to have you touch my finger and then touch your nose, and then we're going to meet at different spots. So my finger, your nose. My finger, your nose. My finger, your nose. Good job. Okay, so next I'm just going to start with her head. Her head is normocephalic, round. I'm not noticing any lesions or rashes or anything on her head. Her hair is well groomed and evenly distributed. No nicks or anything noted. All her facial features are symmetrical. I'm going to have you raise your eyebrows for me. Lift them up and down. Bring them down. Good job. I'm also going to have you smile real big for me. Good job. Her smile is even. She's lifting her eyebrows evenly. All the facial features are even. Okay, honey. So first I'm just going to start by, we're going to start by looking at your eyes, okay? So before she came in for her exam, we did get some vitals. Her vitals were within normal limits. Also, the nurse's assistant did do a quick some vision and hearing tests. So as far as her eyes go, you wear glasses, right, honey? Mm-hmm. Okay. Nearsighted?
Farsighted.
Farsighted? Okay. And her test did come back normal, and also she follows up with her ophthalmologist as well. Any excessive like pain or itchiness, watery eyes, or excessive dry eyes? Okay, good. The first thing that I'm noticing is that her eyes are conjugate and midline, no excessive movement noted. Okay, I'm just going to shine this light at your eyes. So right now her pupils are about a 5. They restrict to about a 3. Good job. Okay, we're just going to do some silly tests, okay? First thing I want you to do is I want you to just follow my finger but keep your head still. So just with your eyes, okay? So right now, I'm just checking her eyes. She's following my finger just fine. Eye movement is very smooth. Okay, we're going to go in, follow. Awesome. So Perla is intact. Okay, I'm going to have you just look at me, okay? Can you see this? Oh, but just keep looking at me and I'm going to raise my hand, okay? Oh, keep looking this way. You see that? You see that? You see that? All right. Peripheral vision fields are intact. She has brown eyes. I'm not noticing any discharge or excessive like tearing or anything. Her sclera is white. The conjunctiva, I'm just going to pull your eyes down, okay? Pink, no discharge noted. I'm looking at her eyelashes. The hair is evenly distributed, and I'm not noticing any knits or anything like that. Okay, so next week, I'm going to do an eye exam on you, okay? So this is my ophthalmoscope. The light is a little bit bright, okay? So I'm going to look at one eye, and then we'll take a break because your eyes might water a little bit, okay?
Okay.
So first, let's just start with the right eye. So I'm just going to get my settings together, okay? You just relax. Okay, so you just look straight ahead. The first thing I'm going to do, I'm just going to check. Red light reflex is present on the right eye. Okay, so I'm going to, and for COVID, I'll throw this mask on because I am going to have to get pretty close to your face, okay? You just continue to look straight, and then at some point I will tell you to look at the bright light, but I'll tell you when, okay? Just look straight. Red light reflex present. I'm seeing normal veins and arteries. Good job. Okay, look at the bright light for 1 second. I know it's super bright. I'm sorry. Okay, go ahead and look straight again. Super bright, right? You okay? Okay, so I noticed normal veins and arteries. Do you see any floaties sometimes?
No.
Okay. The macula densa was present. I didn't see any hemorrhages or any excess bodies in there. The right eye looks pretty good. Okay, so we're gonna do the same thing on the left eye. I'm just gonna go in. Okay, you just look straight at first, okay? Red light reflex is present on the left eye. Okay, I'm gonna go in. You just look straight, okay? Okay, go ahead and look at the bright light. Okay, go ahead and look back. Okay, same thing. So the arteries and veins were present. I didn't notice any excessive hemorrhaging or any foreign bodies in there. So all good. You guys okay?
Mm-hmm.
Okay, good. So next we're going to move on to, let me turn this off. We're going to move on to the patient's nose. Do you have allergies?
No.
No? Okay. Any cough or sneezing recently?
No.
Okay. So the patient's nose is midline. I'm looking at her breathing, and her she's breathing good. I'm not noticing any excessive flaring coming from her nostrils, so that's really good. I'm not noticing any foreign body. She doesn't have any discharge. I'm just watching her breathe, and she's doing that. Okay, so I'm going to occlude each nostril, and I just want you to breathe, okay? Good. No nasal flaring noted. I am going to take a quick look in your nose, okay?
Okay.
I'm just going to check any foreign bodies. No foreign bodies noted. The nasal passages are not red or swollen. No excessive discharge or anything noted. Next, I'm going to move on to her ears. So I see 2 ears. They are symmetrical. I'm just going to feel in your ears a little bit, honey, okay? The pinna is level to the eye. I'm just going to wiggle this ear. Any pain when I touch this ear?
No.
No. Okay, I'm going to wiggle this ear. Any pain when I touch this ear? Just looking at her ears, I'm not noticing any lesions. I'm not noticing any excessive cerumen or discharge. She does have pierced ears, and they are without signs of infection. Okay, so honey, next I'm just going to look into your ears. It might tickle a little bit, okay?
Okay.
So looking at the outer part of her ears, I'm not noticing anything adventitious. Right now, I'm going to look into her left ear. Okay. You doing okay?
Mm-hmm.
All right, no excessive wax noted. I'm seeing a pearly gray tympanic membrane. You might feel a little puff of air, okay? Do you feel that?
Mm-hmm.
Pearly gray from the tympanic membrane. I am noticing a cone of light, and with the puff of air, I'm not noticing any excessive movement with the eardrum. Okay, I'm going to do the same thing on your right ear, okay? Well, I can see this one very well, okay? No excessive earwax noted in this ear. I am noticing a pearly gray tympanic membrane and a cone of light. I'm going to give a little puff of air, okay? Good. I'm not noticing any redness or discharge in either ear. Hold on one second. Okay, good job. You doing okay?
Mm-hmm.
Okay. Next we are going to move on to the mouth. So I'm just gonna have you, I am gonna do a little oral exam on you, honey, okay? Brought some gloves with me. Just make sure it's recording. Okay, good. So first I'm just gonna have you go cheese. Okay, the patient is well groomed, hygiene good, teeth look great. Go open up for me. I'm going to check those teeth. She does have mixed dentures. She has both her primary and secondary teeth coming in. Any sore throat or sores in your mouth or anything like that? Okay. Okay, I'm going to have you open up real wide. I'm going to have you stick your tongue out. Go ahead. I'm just going to tongue depress you a little bit. Go ahead, relax your tongue just a little bit. Okay? I'm going to check your cheeks, okay? I'm checking her cheeks to look for any lesions. I don't notice any. I'm checking her lips to look for any lesions. Her gums are pink, no redness noted. I'm not noticing any swelling. Also, her tongue is midline. Stick your tongue out for me. Move it to the right. Move it to the left. No, and then stick your tongue up for me. No lesions noted on the tongue. Also, by checking the tongue and doing this, we are checking the hypoglossal cranial nerve. When I looked into the back of her mouth, I did notice that her uvula was midline and her tonsils were at +1, which is normal. She denies a sore throat at this time, and I'm not noticing any excess redness or bleeding or drainage or anything of the sort. Teeth are well groomed, and breath odor is normal. I'm not noticing anything adventitious. So next, I'm going to move on to the neck, okay? So first, I'm going to come behind you. I want you to swallow for me. Good. So you're just going to feel me touch your neck and move some things, okay? Right now, I am checking her trachea, or I'm sorry, her thyroid. The thyroid is moving easily. I'm not noticing any lumps or bumps. Trachea midline. Okay, so we're going to do some silly tests with our neck, okay?
Okay.
I want you to move right to left. I'm just going to have you look each side, right to left. Good. I'm going to have you look up to down. Up and down, I'm sorry. Good job. I'm going to put my hand here. Push against my hand with your head. Good job. Push against my hand with your head. I'm going to have you do your ear to your shoulder. Good job. And I'm going to put my hands on your shoulders. I want you to raise them, like try to push against. Good job. Right now we're just checking all the range of motion with your neck and your shoulders and stuff like that, okay? Also, while we're playing some of these silly games, I want you to take your arms out, circle forward, circle back. I'm going to have you hold your arms out for a couple seconds, okay? By doing this, we're checking her range of motion, and then right now we're also checking her coordination by doing this move. I'm looking to see if she drops them or she starts to tremor, which she is not doing. Good job. I'm going to have you put your hands up. And then I'm going to have you kind of like scale down your back as slow as you can, and then bring it back up. Good job. And you can put those at her side. So yeah, we just checked her neck strength and range of motion in the upper part of the body. She did great. Okay, so this is very silly. I'm gonna listen to your neck, okay? Deep breath. Good job. Okay, so I just auscultated over the trachea and I did hear bronchial sounds. So next we're gonna move on. Oh, before we move on, I'm sorry, I'm gonna do one more thing. I'm gonna check all your lymph nodes, okay, honey? So you tell me if you feel any pain while I'm doing this, okay? So right now, I'm just checking her lymph nodes and I'm just moving in a head to toe sequence. Okay. Any pain when I did any of that?
No.
And I did not feel any lumps or bumps or anything of this sort. Also, while I'm here, I'm gonna have you, can you go like, take a bite like, ah, ah, ah. So I'm checking the temporal mandibular joint right now. Any pain with that?
No.
I'm not noticing any clicking or any stiffness or anything with the sort. She was moving her jaw smoothly, so that's all good. Next, we'll move on to the thorax. So while I'm behind her, I'm going to have you, I'm going to put my hands behind her. Take a deep breath, honey. Again. So I'm just looking to see if my hands are moving symmetrically, which they are. I'm going to have you just take a couple breaths and I'm going to look at you, okay? Okay, which each breath, her chest rise is symmetrical. I'm checking her AP to transverse diameters. Those are normal. So I'm gonna just take a listen to you, okay? You just breathe. I'm gonna listen to her posterior sound, or I'm sorry, her lateral sounds. And all these sounds are clear to auscultation. Okay, good. Oh, also, I am going to, I'm just checking for crepitus. I don't notice anything. Honey, I'm going to have you say, can you say, I am going to place my hands on your back. I want you to say 99.
99.
Do it again.
99.
Okay, I'm noticing any tactile firmitus, so that's good. Okay, so the next thing that we're going to do, I am just going to tap onto your chest, okay? So right now I am percussing her lungs. The sound that is being produced is resonance, which is normal over the lung fields. Okay, I'm gonna do the front, okay? Okay, so also with her chest, she is about a Tanner stage 1. I'm not noticing any lesions or rash or anything over her thorax area. Everything looks good. Okay. Next, I am going to just listen to your heart while you're sitting up, okay? So I'm going to listen to her heart in the 8 to man sequence. Right now, at the base of her heart, S2 is greater or louder than S1. And at S1, or I'm sorry, the apex of the heart, S1, is louder than S2. Also, I'm just going to feel right here, okay? We're going to try to palpate your apical pulse. Point of maximum intensity, and I can palpate her apical pulse. I'm just counting, okay? Okay, good. At this point, I'm gonna have you lay down, sweetie. Okay, I'm gonna help straighten you out. So now we're gonna go on to the next portion of our exam where we'll have the patient laying down, but we're just gonna right now continue with the heart sounds. We're now gonna listen in the laying down motion. Same sequence, ape to man. Right now, S2 louder than S1. S1 now louder than S2. I'm going to turn you a little bit on your left side. Hold on, I'm going to help you out. Turn a little bit more. Okay, sounds good. Next, we'll move on to the abdomen. So as she's laying flat, I'm noticing that her, the contour of her abdomen is flat and soft. Oh, I apologize. While I have her laying this way as well, and we just listened to her heart, I checked her peripheral upper extremity pulses earlier, but I'm just going to check her carotids. Normal. Okay, so back to the abdomen. The abdomen is flat and is soft, normal contour. So the first thing that I'm going to do, I'm just going to lift your shirt a little bit, okay? Okay, I'm just going to take a listen, okay? So we're going to listen in the 4 quadrants. Any nausea or vomiting complaints lately? Peeing and pooping okay?
Yeah.
Last bowel movement? It's been a couple days? Maybe like yesterday? Okay, yes, and is that normal for you?
Yes.
Okay. I'm also going to listen with my other side of my stethoscope. Okay, so I hear bowel sounds in all 4 quadrants. So the next thing that we're going to do, I'm just leave this here. Oh, and we're going to listen for aortic pulse, any bruise. No adventitious sounds noted. So the next thing I'm going to do is the same one. I was kind of like tapping on your chest. I'm going to do the same thing over your belly, okay?
Okay.
I'm going to start about here. So the first thing we're going to do is we're going to check, we're going to percuss over the liver. So typically in the abdominal area, you want to hear a timpani sound, but when you get over an organ, you hear dullness. So can you put your finger right here for me with, yep, that works, right there. Put this finger for me right here. I know it's kind of awkward. Just give me 1 second. Centimeters is what I got for the measurement of her liver, which for a child is appropriate. Okay, you can go ahead and relax your arms, honey. And then I'm just going to continue to do the same thing all over your belly. Good. Next thing I'm going to do is I'm just going to gently feel your belly, okay? Tell me if you have any pain. Patient is relaxed. She's not flinching, no guarding or anything. Good? Okay, so next I'm going to do the same thing, but it's going to be a little bit deeper because now I'm trying to feel for any like lumps, bumps, masses, okay? no lumps, bumps, or masses or anything felt or noted. I did not feel the spleen. Okay, I'm just going to check right here. I'm going to check your inguinal nodes. And then I'm also just going to check your pulse, okay? Your femoral pulse. Right femoral pulse. Left femoral pulse. Okay, good. So go ahead and keep laying down. Now we're going to move on to the lower extremities. So I'm looking at her legs. No rashes or anything noted. Her toes well groomed. I'm not noticing any clubbing, any rashes or fungal infections on the toes. Okay, so we're going to come down. I'm going to check the pulse behind the knees. Pulse is here. I'm going to check the pulses on the top of your feet. Your pedal pulses. Okay, so now we're just going to do some range of motion again. So I'm just going to move you around and check your strength and stuff like that, okay? So the first thing I want you to do is push down on my hands really hard, like push on the gas pedal. Good job. I'm going to have you pull up towards you. Good job. I want you to rotate those ankles in a circle. Good job. So she has good range of motion in her ankles and her feet. So first I'm going to take this. We'll do your right leg. I'm going to bend it. Okay, go ahead and push down on my hand real hard. Good job. Okay, so right now we're checking her knee. I'm going to abduct and adduct your right leg, which means I'm going to move it away and towards the body, okay? Any pain? No. She denies any pain, and also I'm not noticing any like clicking. She moves this leg, this extremity, very good. Next, we're going to do the same thing on the right. So it's just 90 degrees. Okay, I want you to push on my hand. Good. Then we're going to bring it up towards you. Any pain? No. And then we're also going to do the same thing where we're just going to move that hip. Good job. And I'm not noticing any clicking or anything like that with this extremity as well. Any pain when I kind of like move this one? Good. Legs move freely. Okay, honey, I'm going to have you sit back up again. Okay, so now we're going to do a couple of silly things. The first thing, I'm going to have you come stand right here for a second. Or, oh, that works. Okay, so I'm just going to have you, we're just going to walk. I just want to watch you walk. Good. The patient walked a straight line just fine. So next thing I'm going to have you do is heel toe. So I'm going to have you, yep, just walk heel toe. Good job. Then next thing I'm going to have you do, I'm going to have you get like a little bit in the camera, just a little bit. I'm going to have you jump up and down on one foot, on the other foot. Good job. So the patient did all of that. Her coordination is intact. Okay, I'm going to have you come step about right here. So right now I'm just observing her spine. Her spine is straight. Her hips are even. Okay, I'm going to have you bend over and touch your toes. When she bends over, you can stay down for a second. Her spine is still midline. I'm not noticing any excessive curvature, and her hips are still equal. Good job. Okay, you can come and you can sit right here. I'm going to have you take the heel of your foot and run it down your shin, just like that. Good job. Now try it with the other one. Good job. So now we're going to get into some neuro stuff. So the first thing I'm going to have you do, we're just going to play like a series of silly little games. Okay, so I'll have you close your eyes, okay? And then I want you to tell me if you can feel two things or just like one thing, okay? So how many pokes is this?
2.
Try again.
3.
Well, like, okay, you're totally right. But so what I mean, I should explain it better, is if you feel, so this will be one object, this will be 2 objects, okay?
Mm-hmm.
Make sense now? Okay, so close your eyes.
1, 2,
rubbing this down your hand. Okay. You feel this? Me just rubbing this down your hand. Okay, we're gonna do the same thing with your feet. Close your eyes. Is it 2 or 1?
2. 1.
Oh.
2. 1.
Okay, good job. So did all of that. We also did a mental health exam on our patient before she came in, and that was all within normal limits. She is alert and oriented ×3. She's not complaining of like any bullying or like depression or anything like that. We did do a mental health screening, and that was all fine. She did say she felt safe at home before she came in, so that was all good. So the next thing we're gonna do, we're just gonna check your reflexes, okay? So the first one I'm gonna check is your brachial. So I'm just gonna bend your hand just so I can find my. I'm just gonna. Good. So we're just looking to see for this hand to move a little bit. Okay, I'm gonna bend your arm a little bit, find that cord. Good job. Good. Okay, so I need you to completely relax your arm for this one. This one's kind of hard, but you got to completely relax, okay? Good. All right, now we're checking our triceps, deep tendon reflexes. Okay, you ready? Good. Next we're going to do our radial. So for this one, oh, there we go. That was a good one. Okay. So we're just looking to see like that hand and that thumb move just a little bit. We're going to find that little notch on the wrist and go a couple centimeters above it. Okay, there we go. I can feel that one in my hand. Next one we're gonna try scooting back just a little bit so we get your feet to, or just enough so your feet dangle a little bit. Come a little bit forward. So next we're going to try our patellar. So we just did our brachial, our tricep, and our radial deep tendon reflexes. Now we're going to try our patellar. Good. Try the left. Oh, that was a good one. And the last one, we're going to try the ankle. So I need to support this foot a little bit. Maybe go this way. Oh, that was a really good one. I could feel her hand. So I'm supporting that foot, hitting the nerve back here, and I could feel her foot pressed down a little bit. So that was good. We're going to try this again on this side. Oh, that was a good one. So all of her deep tendon reflexes are present. So that would about conclude the exam. They did get vital signs before she came in, and all of her vital signs were appropriate. I checked her height and her weight, and they are appropriate for her age and her size. She, like I said earlier, does wear glasses, and they did do an eye exam before she came in, and she also has her ophthalmology appointment coming up soon. They did do a hearing test before she came in. The nurses aide did a Renee and Weber test, and both of those were normal. Do you have any questions for me or any concerns? No. The patient has denied pain, and this would be the end of our assessment. Okay, so just a couple things that we forgot in our assessment that I'm gonna have my patient do. So we're gonna do another musculoskeletal test. So I'm just gonna have you do something really silly. It's called walk like a duck. Can you do that for me? Good job. And then the other thing that I did want to note, when I checked her spine and everything earlier, her hips were even, but also that her scapula, they are perpendicular, 90 degrees. Her shoulders are even to the spine. No curvature, like I said, was noted. And her hips are even and symmetrical. And then when she bent over, they were symmetrical as well. And that is the end.